most people with mental disorders live productive lives in the community. Sometimes they may need the additional support and care that a psychiatric hospital can provide. Psychiatric nurses and other mental health care providers who work in psychiatric hospitals help patients to manage their symptoms and assist patients who are in crisis. Sometimes, psychiatric workers are exposed to violence or other challenging behaviors. The Trauma Among Psychiatric Workers project surveyed staff who work at 3 psychiatric hospitals across Ontario, Canada. Over 750 responded, a 62% response rate. 2/3 of surveyed staff had been directly exposed to at least one critical event. This included staff who were physically or sexually assaulted while at work, injured while restraining a patient, or threatened with serious harm to themselves or to their families by a patient. Almost all surveyed staff had been exposed in some way, whether it happened to them, they witnessed it, they responded to the call for help, they learned about it happening to a close colleague, or they were repeatedly exposed to the details by investigating or reporting it. It is normal to feel stressed after a traumatic event. That stress comes from the abnormal experience, not personal weakness. The stress often decreases slowly over time, and talking about it can be helpful. For some people, the stress reaction doesn't go away, and it can develop into PTSD. In the Trauma Among Psychiatric Workers survey, 1 out of every 6 staff screened positive for PTSD, according to a screening tool. Among forensic staff, the prevalence rate of positive screens was 22%, about the same as reported for paramedics and police officers in other research conducted across Canada. Have you been exposed to a traumatic event? Do you re-experience the traumatic event through nightmares, flashbacks, or unwanted memories? Do you try to avoid the thoughts, people, or places that remind you of the traumatic event, or blame yourself for what happened? Have you become easily startled or hypervigilant, lost interest in things you usually enjoy, or had difficulty sleeping or concentrating? If you've had these problems for over a month, and they're distressing you or interfering with your life, you may be at risk for PTSD. In our survey, most staff who met the cutoff for PTSD recognized that they needed help. However, over 2/3 tried to handle PTSD on their own, using self-help or no help. There are effective treatments for PTSD. Consider talking to a regulated health professional about structured psychotherapy for your PTSD symptoms. Psychiatric hospitals can be very rewarding places to work, but the work can also be stressful. Practicing self-care and seeking help during times of extra stress can help you stay strong while you protect and care for your patients. For more information about our research, go to traumaamongpsychiatricworkers.net.